Welcome to the video training program of InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We're excited to show you everything InTouch EMR can do to streamline your practice. So let's get started.
Hi everyone, this is Nitin Choda, CEO of InTouchEMR.com and InTouchBillerPro.com, and in this video training we'll talk about the impact of Obamacare on Medicaid and Medicare patients. Now, according to Obamacare, one of the mandates in Obamacare is that for states that agree to do so, Medicaid will actually be expanded to include individuals that earn up to 138% of the federal poverty level, which is right around $15,800 in 2013. Now, according to the Congressional Budget Office, or the CBO, this is projected to add 12 million individuals to Medicaid by 2015. So basically, there are going to be a lot of additional Medicaid patients that are essentially in the US healthcare system. Now, this is a good thing for individuals who need care, but here's the problem. In 2011 alone, 1 out of 3 physicians refused to accept Medicaid. So we are potentially dealing with a problem where there are additional patients who require care. These patients, these Medicaid patients already have fundamental issues like, unable to find physicians or private practice owners or clinicians who will accept Medicaid. So now there'll be more individuals seeking essentially less people who are willing to accept Medicaid. The second problem is there's going to be an overcrowding in hospitals. There's going to be an overcrowding in clinics that do accept Medicaid patients. So that's one part of the problem. Now with Medicare, there is some good news. The Obamacare, the Affordable Health Care Act, has actually closed the donut hole, which was basically a loophole where Medicare patients were expected to pay out of pocket for certain medications. The good news with Obamacare is that the cost for prescription medications will reduce. The cost for preventive services like cancer screenings, vaccines, wellness services, flu shots, all of those are going to be free or close to free under Obamacare. But here's the thing, Medicare Advantage programs will see an impact. There could either be an increase in co-pays or an increase in deductibles or both. The bottom line is that Obamacare is seeking to reduce expenses by reducing reimbursements to Medicare providers, which is going to cause probably a fallout there as well. Not only are we going to see less clinicians seeing Medicaid patients, we could also see less clinicians seeing Medicare patients. And at the same time, for Medicare, for some Medicare is not going away, so let's be clear about that. But the fact is, Medicare is going to fundamentally change because patients are going to wake up to the new reality of higher co-pays and higher deductibles, which is something that it can swing both ways. You can call it a bad thing, you can call it a good thing. We're not going to necessarily discuss political considerations or moral considerations here. This video training is about objective economic realities and how it can impact you as a private practice owner. What's the bottom line? There are more Medicare patients, there are more Medicaid patients, and since the reimbursement is less, there's going to be less people willing to see them. This presents an opportunity for clinicians who are willing to see these patients and get them better faster, because the objective for the government is going to be reduced costs. So that's one opportunity. The other opportunity is, since patients have already been conditioned or are being conditioned to pay higher co-pays and pay higher deductibles, you can now present them with other programs that can help them get better faster, that potentially cause the patient to spend even less than their co-pays and deductibles. Think about it. If a patient's going to now be forced to pay you a $40 copay, what if you offer the patient a $30 a month, I'm sorry, not a $30 a month, a $30 a session or a $20 a session wellness program, a group exercise program, a prevention program, whether it's going to be covered or not, that's something that we have to wait and see how the prevention and the maintenance policies with Medicare and with other insurers evolve. But you can provide those services right now to your patients. You can do that right now in a group environment for patients when applicable, and you can do that to raise your income, to lower costs for patients, to get patients better faster. In the new economy, in the Obamacare economy, where there are going to be more Medicare patients, more Medicaid patients, and less reimbursement for those services, you need to ask yourself, what can you do to be a part of the solution and not be a part of the problem and then, drop out or even shut down your practice. We don't want that. I've been a private practice consultant, a business strategist for several years now. We've built software like newsletter services like the therapy newsletter, InTouch EMR, InTouch Biller Pro. And I want you to succeed as a private practice owner, but you have to be aware of what's happening with Medicare and Medicaid patients and plan accordingly so that you're prepared and thinking one step ahead. Thank you so much for watching, and I wish you all the best as you see an increase in Medicare and Medicaid patients and serve them better in the new economy. Thank you.
Thanks for watching this video training from InTouch EMR, the fast, simple, and integrated EMR that adapts to you. We'll see you in the next training module.